Okay, friends. Now let us understand the both nephritic as well as nephrotic syndrome. The renal syndromes are divided into nephritic as well as nephrotic syndromes. First of all, we will have an overview. What is nephritic syndrome and what it includes, and what is nephrotic syndrome and what it includes. Let's begin. See, nephritic syndrome includes the microscopic hematuria, mild proteinuria, sodium and water retention, hypertension, edema, oliguria. But in the nephrotic syndrome, we can see heavy proteinuria. The major difference between the nephritic and nephrotic syndrome is heavy and mild proteinuria. Even though there is heavy proteinuria, but here is hypoalbuminemia. Since the protein is excreted more, there will be less amount of albuminemia, and edema is seen in both regions, and there is a hyperlipidemia. Since the increase in the content of the lipid, obviously urine also can excrete more lipid, that is lipiduria, and hypercoagulability. This is the overview of nephrotic and nephritic syndrome. Now let us study individually, and let us see what is nephritic syndrome and what is nephrotic syndrome, and what are its symptoms and what are its causes and what are the other things to be noted. Let's begin with the nephritic syndrome. Okay, this nephrotic syndrome has classical symptoms such as hematuria. When there is hematuria, obviously there will be RBCs can be detected in the microscopy, and presence of RBCs const clinical symptoms of nephritic syndrome. Then proteinuria. Okay, we have this proteinuria in both the cases of nephritic as well as nephrotic syndrome. Then what makes it different? It is mild proteinuria, that is less than 3 gram per day. This is to be noted. Mild proteinuria less than 3 gram per day, and the proteins which are excreted are non-selective. Then sodium and water retention, it is a classical symptom. Hypertension depending on the severity of the glomerular disease results in the sodium and water retention. Glomerulus is the function of, as we studied in the previous video, the function of this glomerulus is the filtration. Since there is a glomerular disease, obviously there will be the retention of sodium and water. Then wherever the water is accumulated or wherever there is something accumulated, there will always be edema. So edema is due to the retention of sodium and water. And oliguria, no urea. In this oliguria reflects the severity of glomerular involvement. So classical symptom is oliguria. Let us see where this nephritis or nephritic syndrome is seen. Nephritic syndrome is seen in the primary glomerulonephritis, such as post-streptococcal glomerulonephritis or rapidly progressive glomerulonephritis. Nephritic, nephritic, this is basically associated with the glomerulus. So we can write whatever the disease associated with glomerulus, maximum of the disease. What kind of glomerulonephritis we have? One is post-streptococcal glomerulonephritis, another one is rapidly progressive glomerulonephritis, then focal and diffuse glomerulonephritis, and IgA nephropathy. This is to be some additive point, I guess. IgA. Nephritic don't have A, so IgA. Then we can also see this nephritic syndrome in some systemic disease like SLE, polyarthritis nodosa, Wegener granulomatosis, Henoch-Schönlein purpura, and cryoglobulinemia. Just remember this SLE and cryoglobulinemia and all these things. If you want, you can remember, but that is not of much importance. Anyway, they are asked in the competitive exam as well. So now let us move on to the next thing, that is nephrotic syndrome. What happens in the nephrotic syndrome, as well as what are the difference. In nephrotic syndrome, we will see the heavy proteinuria. There it was less than 3 gram per day, but here it is more than 3 gram per day. Then here proteins, especially albumin, is lost. Since the albumin is lost, we will see hypoalbuminemia. That is, usually the plasma albumin level is 3.5 to 5.5 gram per dl. But what happens here is the albumin level reaches to 1 to 3 gram per deciliter. So Ag means albumin to globulin. This ratio is reversed. So there are few conditions where this ratio of Ag is reversed. We will see that later. Then let us see how this happens. Like immunoglobulins are vulnerable to infections, means whenever there is infection, the immunoglobulin increases. Spontaneous bacterial peritonitis is most common infection. Like during the infection of pneumococcus and E. coli, there will be production of immunoglobulins and antithrombin 3 and transferrin, concentration of other proteins plasma, okay, and cholecalciferol and thyroxine. Like decrease in the antithrombin 3 causes to thrombosis, and transferins, if the transferrin is reduced, we can see the microcytic hypochromic anemia because it is iron deficiency anemia. When the cholecalciferol binding protein is reduced, we can see hypocalcemia because cholecalciferol is required for the transport of calcium, and thyroxine binding globulin causes decreased thyroxine level, which might cause hypothyroidism. Then fibrinogen is increased due to the infection. Then edema, standard, but here there means in the nephritic syndrome, the edema is caused due to the increase in the level of water and sodium retention or water and potassium retention. But here it is due to the fall of osmotic pressure, that is decreased in the albumin. It is not due to sodium and water retention. This is to be noted. Then let us go for hyperlipidemia. Since there is less level of albumin, liver obviously face stress because albumin is produced in liver. Body should increase the level of albumin, so liver faces stress. Due to this stress, there will be the increased synthesis of lipoproteins. As the lipoproteins are increased, the body should excrete the lipoproteins, so there will be the hyperlipidemia and hypercoagulability. This is because here we can see fibrinogens. So since the level of fibrinogens are increased, we can see hypercoagulability, increased urinary loss of antithrombin 3 and hyperfibrinogemia. Okay, let us see the example, like where we can see it. It is seen in the primary glomerulonephritic conditions. There is membranous glomerulonephritis and focal and diffuse proliferative necrosis and IgA nephropathy. But okay, This glomerulonephritis can also be seen in membranoproliferative glomerulonephritis, membranous glomerulonephritis, focal and diffuse proliferative glomerulonephritis, IgA nephropathy, and diabetes mellitus. In the systemic, we can see diabetes mellitus, amyloidosis, and SLE. It is common for both nephrotic and nephritic syndrome. Then let us see some basic difference which are usually asked. This table states that proteinuria is mild here, heavier. Hypoalbuminemia is not seen, it present. Edema is mild, but it is marked in nephrotic syndrome. Mechanism of edema: hematuria present, here absent. Hypertension present, here present. Hyperlipidemia absent, present. Lipiduria absent, present. Oliguria present, present. Hypercoagulability absent, present. When we understand this table, then we can easily differentiate the things. Like azotemia. There is a word called azotemia which is seen in the nephritic syndrome. It is the biochemical abnormality characterized by elevation of BUN and creatinine level. Uremia caused to azotemia plus clinical signs and symptoms. That's why azotemia is because of the uremia which is present in nephritic syndrome. Okay friends, we will meet in the next video. Till then, bye.